Okay, we're going to go ahead and start with the inspection of the abdomen. This is our patient here. We've asked him to go ahead and lay down in a supine position, meaning his belly is upward and toward the ceiling. His arms are at either side of his body, as shown here. We've also asked him to go ahead and go to the restroom and to urinate if he can. This is in order to be able to inspect his abdomen a little bit better, because if it is dilated, we may not be able to inspect the other organs as well as we should. Okay, so now that he has gone to the restroom, we've also asked him to lay down in a supine position. We've applied pillows to the back of his head and below his knees for comfort. Now we're going to go ahead and expose his abdomen as much as possible, and we're also going to place a sheet over him just for comfort and warmth measures here. So here we are looking at his abdomen. Now we will start with the inspection of the abdomen. This does not include any type of palpation or percussing or auscultating. This is just looking at it. And the first thing that we are looking at is the skin. Now realize that we are looking from the portion of the costophrenic margins here down to above the pubic area. This is the area that we are inspecting right now. Now when we look at the skin, we're making sure that the color is equal throughout. Now note that in some cases this may be a little lighter than the rest of the body, just because patients do not expose this area to the sun. Other things that we're looking for are in any areas of cyanosis, especially here in the umbilical area, maybe any discolorations, jaundice, redness, bruising, anything like that. So as we can see here, he's got a little redness here. Looks like in areas where the follicles might have gotten infected there. But other than that, nothing really significant of note here. Then we're going to go ahead and take a look and inspect to see if we see any scars or lesions anywhere. Now when we look at it, we really can't see any except for one here that we noticed right here. And when we do find a scar, we do want to ask the patient if they have a recollection of that scar. In this case, this patient states that he had an appendectomy in the past, so that's the reason for that scar there. When we find a scar, we also want to make sure that we document it by location, consistency, and length and size of it. So in this case, we want to draw an imaginary line here going horizontally, and then another one going perpendicular to that one, going through the umbilicus from the sternum and in between the costral angles downward through the umbilicus. And that way we can use that mapping method to differentiate the right upper quadrant from the right lower quadrant, and then again the left upper quadrant from the left lower quadrant there. So in this case, we would say the location of this scar would be the right lower quadrant. We would also state that it's about 2 inches in length. When we palpate it, we do want to make sure if the patient has any tenderness, which he doesn't, and just state the color of it, and if there's any hardness that you feel, or maybe any protrusions that could indicate a possible hernia through the musculature from that incision site. Okay, so all these are negative findings. We will go ahead and continue with looking at the contour of the abdomen. Now when we do this, we want to check from a side angle, just like that, and then we will also want to check from a head view, if you want to stand behind the head of the patient and look downward like that. And this way we're able to determine what kind of contour it is. Now there's 3 different types. There's one that is flat like this. In these cases, we normally see these in patients that are very athletic with strong abdominal muscles. Sometimes we may see curvature like this in a convex manner. Normally we see these in children, which is absolutely normal, but in adults we might see it as well. mostly because it's a deep layer of subcutaneous fat that's underneath there. And when we do find that, we want to check the umbilicus side as well, making sure that it is not facing a different way, and that the highest point of the contour of the abdomen is at the point of the umbilicus. So in this case, this is where the highest point of the umbilicus should be if it was in a convex manner. Now we also might see a sphenoid or concave abdomen. That would be where it kind of caves in a little bit. We see this in our very thin or emaciated patients. And we'll explain more about those types of patients and further assessment in just a little bit. So after we take a look at that, we want to make sure that we do have symmetry on both sides, especially during respiration. So when we ask the patient to go ahead and breathe normal, in males normally we will see that the abdomen just does rise and fall, and in females mostly we see this here in the costal area there mostly. So in this case, go ahead and breathe normal. Okay, so we can see there that his breathing is symmetrical on both sides, and the abdomen does move in a very smooth and gentle manner with the respirations. So to further inspect the abdomen, we're going to go ahead and ask the patient to go ahead and take a deep breath in and hold it. Okay, so now we're looking there. Go ahead and let it go. When we do this, what we're checking is we're asking him to go ahead and expand his lungs the most that he can through the contraction of his diaphragm muscle that is putting pressure down onto the organs here, so that if there were any masses, nodules, hernias that we have not seen when those muscles are relaxed, the pressure of that diaphragm on those organs may be able to protrude them a little more so as we can see them. Another trick that we can use is we're going to go ahead and ask the patient to go ahead and lift his head from the pillow there. Now as you can see here, his abdominis rectus muscles are now contracted. This is another way, go ahead and rest your head back down. This is another way that we can identify to see if there is any superficial type of hernias or masses that we have not seen, because as the abdomen rectus muscles contract, they put pressure going upward on anything above it, so they are more visible at that time. In cases where, like such as in this case, where there has been incisions made through the musculature, you want to make sure that no hernias arise, as that musculature may have not anastomosed again, and it just kind of protrudes through the musculature that way. Now, as we were talking about our thin patients and how they have a contour that is concave, in these types of patients, normally during the assessment of the abdominal movement that we were talking about with respiration, you will see the respiration with these individuals, but also it'll be much easier to see even peristalsis of the gastrointestinal tract here in the large intestine and maybe even the small intestine with these individuals, just because they don't have very many layers of subcutaneous fat that covers them. So sometimes you'll be able to see the ripples there. However, if the patient, such as in this case, is of a normal or average weight with some subcutaneous fat there, and you see something like a movement like that, you definitely want to continue to assess the patient for a possible obstruction, because you shouldn't be able to see that there, and it may determine or point towards a possible dilation of intestine there, and that's why it sticks out a lot more often. Also, if you see a pulsation right above the umbilicus like this, then that can also, it could be seen in very thin individuals. However, if a patient such as this if you see that in a patient like that, you definitely want to assess that, because it could be possibly an aortic aneurysm that could be developing, and you have a very, very large pulsation with bleeding included, so you see it a lot more prominently that way. So one last thing that I did not mention here when we're inspecting the patient. Now, I forgot to mention this. Now, when we are assessing the abdomen, it is important to understand that all veins that are above the umbilicus return blood back to the head, whereas below the umbilicus they move towards the legs, towards the feet. Now, this venous return, the way that we can assess this is, let's say in our hands, we would consider these extremities above the umbilicus. So in this case, if we look at it, this particular vein right here, you want to take 2 of your index fingers from each hand. In this case, I'm just going to use my one hand. But you're going to put pressure on a vein and you're going to milk it just like this, so that you take all the blood out of it. Now in this case, since the blood is supposedly going back to the head, in this case it would go from the hand back to the head, going upward. So if this is the case, if I remove this one, you will see that the venous return, or the blood did not come back there. Now if I remove this one, did you see how the recoil happened there? Here, I'll try it again. So nothing, then you saw that, okay? So that's because that venous return is going back towards the head, whereas opposed, if we were to use another vein down towards the lower extremities below the umbilicus, it would be the opposite in that, okay? So we're going to go ahead and stop this video here on inspection. We'll continue the next one on auscultation.